Hello and welcome to today's lecture. My name is Ibulani and I'll be your guide as we explore today's topic. In this session, we'll be focusing on the nursing management of patients with asthma, and I encourage you to review your textbooks before diving into this video to make the most of the material. We'll be revisiting key concepts and expanding your understanding with practical, easy to follow explanation. This lecture is structured to help you apply your knowledge in real clinical settings with step by step guidance and relevant examples. So, get your notes ready, make yourself comfortable, and let's begin our discussion. Okay, before we start, let's briefly review the learning objectives for today's session. This goal will help us stay focused and clarify what you should know and be able to do by the end of this lecture. By the conclusion of the session, you will be able to understand the pathophysiology and medical management of asthma, and you are able to formulate a whole nursing process started from nursing assessments, diagnosis, interventions, implementation, and do evaluation for patients with asthma. Before we proceed, it is really essential to highlight a critical concept that forms the foundations of this lecture. This is not merely a fact to be memorized, but a pivotal principle that will recur throughout your studies and clinical practice. A true understanding of this concept is indispensable for effective patient care. So let's see all the critical points related to asthma. Asthma is defined as a chronic inflammatory disorder of the airways characterized by irreversible airflow obstruction and bronchial hyperresponsiveness. As outlined in your textbooks, the Lewis Medical Surgical Nursing, the pathophysiology of asthma involves persistent inflammation leading to airway edema, increased mucus secretion, and constriction of bronchial smooth muscles. These pathological changes results in episodic bronchospasm, airway narrowing, and variable airflow limitations. Clinically, the patient presents with symptoms such as wheezing, deep snore, chest tightness, and cough, which may vary in severity and frequency. That's why a comprehensive understanding of this underlying mechanism is really essential for the formulations of effective nursing intervention aimed at symptoms control, prevention of exacerbations, and improvement of patient outcomes. There are some guide treatment based on asthma severity that you can use. The current guidelines focus on the first one is assessing the severity of the disease at diagnosis and initial treatment, and then the second one monitoring periodically to control the disease. And also, a, an asthma, if not treated correctly, it will develop into a life threatening medical emergency, which is status asthmaticus. This is the most extreme form of an acute asthma attack, and it is characterized by hypoxia, hypercapnia, and acute respiratory failure. So it is really important for you to understand the critical points of asthma, the management, and how to prevent it um, to become more severe and develop into life-threatening conditions. Okay, next, let me remind you about the pathophysiology of asthma. I believe that you already watched the video before about all the pathophysiology on asthma, but I will make a brief explanation related to the asthma. Asthma is commonly triggered by factors such as allergens, respiratory infections, exercise, cold air, and environment irritants like smoke or pollutions. In a susceptible individuals, exposure to these triggers may initiate an inflammatory cascade in the airways. Several triggers activate inflammatory response, and it begins with activation of mast cells, eosinophils, and T lymphocytes, which release inflammatory mediators such as histamine, leukotrienes, and prostaglandins. These mediators cause bronchial mucosal edema and increase mucus secretions, which contribute to airway narrowing. Following this, the bronchial smooth muscles undergo spasms, known as bronchoconstrictions or bronchospasm, further reducing airway diameter and increasing airway resistance. The combined effects of edema, mucus hypersecretion, bronchospasm lead to episodic airflow obstruction, causing symptoms like wheezing, coughing, chest tightness, and shortness of breath. With chronic and repeated inflammation, structural changes called airway remodeling may occur. This includes thickening of the basement membrane, fibrosis, smooth muscle hypertrophy, and increased vascularity, which can result in persistent airflow limitation that becomes less reversible over time. It is really important for you to understand the whole pathophysiology because it will help you to understand what implementation that you can do for your patients. Okay, next, this is the interprofessional care for patient with asthma. Like in the videos before, interprofessional care is all about working together um, for every healthcare provider, whether it is physician, nurses, dietitian, respiratory therapist, social worker, and family to help patients um, deal with their asthma. For the physician, they usually start with diagnostic assessment. They take history and physical examination, make a spirometry test, including a response to bronchodilator therapy, measuring the peak expiratory flow rate, take chest X-ray, and also measurement of oximetry and look for the allergies. For management, for patient with asthma, the first one is really important to identify and avoid and eliminate the triggers, and also give the health teaching about how to prevent the triggers to the patients and caregiver. The next one is the drug therapy, which is the bronchodilators and so on that we will see on the next slide. And it is also really important to have asthma action plan for the people, for the patients with asthma, and give desensitization or immunotherapy if indicated, and also assess for the control. During the acute attacks, it is really important to monitor the SaO2, take the ABGs, and also give the inhaled B2 adrenergics agonist and also inhaled anticholinergics. And give the O2 by nasal cannula or mask, give the IV or oral corticosteroid, give the IV fluids, and intubation or assisted ventilations if needed. Okay, this is the medical management for the patient with asthma. It started with the primary care, with the patients presents with acute or subacute asthma exacerbation, and the next thing to do is assess the patient whether it's really the asthma, what is the risk factors, and what is the severity of exacerbation, and make it into the categories whether it's mild or moderate, severe, or life threatening. Based on these categories, you can start the treatment and giving the medications like SABA, prednisolone, and maybe transfer to acute care facility while give the medication and also oxygen. Continue the treatment and also reassess the response at 1 hour or earlier. If the condition is improving or worsening, um, the flow will changes. And if the condition is improving, the doctors usually planning to assess for discharge or arrange at discharge the patient or to be hospitalized. After the situation is controlled, usually they will do follow up um, to see the medication and also for the reliever and controller and also the risk factors and also modify the action plan. Here is the medications for asthma. There are quick relief versus long-term control. So remember, for asthma, there are two main types of medication: quick relief and long-term control. The quick relief or rescue medications, it's called bronchodilator. It's short-acting inhaled B-energenic agonist like albuterol or um, anticholinergics such as ipratropium. And the next one is the anti-inflammatory drugs or corticosteroids like prednisone. For the long term or controller medications, it works with the anti-inflammatory drugs such as corticosteroids that can be inhaled, such as fluticasone, oral prednisone, LTMAs, anti-AGE, and also some long-term bronchodilators, such as long-acting inhaled B-energenic agonists like salmeterol and also long-acting oral albuterol, and also methylsanins or theophylline. These are the drug therapy that you may be seeing for patients with asthma. It's really important for you to understand what kind of medication that need in which condition. Okay, next on the nursing management for patient with asthma. The first thing first, we need to do the nursing assessment. It's really important to gather the subjective data for important health information related to past health history, related to the allergy and trigger, and also their medications, whether the patient is having adherence to medication, inhaler technique or not. Also, it is important to assess about the health perception, health management, activity, exercise, um, whether the patient have fatigue and deep snore, cough, and also the sleep rest cycle and also coping stress tolerance. Remember, emotional distress, stress at work may trigger the asthma episode. For the objective data, we can do general checking, head to toe assessment, and focus on respiratory assessment. Please look for if the patient have restlessness or exhaustion, confusion, upright or forward leaning body position. It means that the patient having an attack and feeling hard to breathe. For the integumentary, you can see diaphoresis and also cyanosis and ischemia. On the respiratory, you may see nasal discharge, crackles, of course, wheezings, and decrease of absent breath sound, which is really alert signs for status asthmaticus. And you may find hyperresonance on percussion. You may see sputum, thick, white, and tenacious, increased work of breathing with use of accessory muscle, and intercostal and supraventricular retractions. Tachypnea with hyperventilation and prolonged expiration. You may see tachycardia and also jugular venous distension and so on. Here is the possible diagnostic findings from the laboratory results. You may find abnormal ABGs during attack with low O2 saturation, serum and sputum eosinophilia, increased serum IgE that related to the sensitivity of the allergy, positive skin test for allergens, chest ray showing hyperinflation with attacks, abnormal pulmonary function tests, and also the ratio between FEV and FVC that improve between attacks while giving bronchodilators. Here is the possible nursing diagnosis that the patient with asthma may have: impaired breathing, activity intolerance, anxiety, and lack of knowledge. Here is the nursing outcomes and planning. The overall goals are that the patient with asthma hopefully will achieve asthma control as evidenced by minimal symptoms during the and night, acceptable activity levels, maintaining greater than 80% of personal best PEFR, few or no adverse effects of therapy, no acute asthma, and adequate knowledge to carry out the plan of care. Okay, for the nursing intervention while the patient in acute care or in hospital, we need to remember the major goal is to maximize the patient ability to safely manage acute asthma using asthma action plan that develop in conjunction with healthcare provider. When the patient is in the healthcare agency with an acute attack, it is important to monitor the patient respiratory and cardiovascular system. This is, of course, including the monitors of heart rate, rhythm, respiratory rate, and work of breathing, and also blood pressure, monitoring pulse oximetry, PFR, ABGs, and auscultating lung sounds. An important nursing goal during acute attack is to decrease patient's anxiety and sense of panic, positioning the patient comfortably to maximize chest expansion. Also, you can teach to do the pursed lip breathing that keeps the airways open by maintaining positive pressure. Here is the asthma action plan that you can see in the picture. It is really, really important for the patient with asthma to be able to go through this plan well. There are three zones: the green, yellow, and red zones, and they have to be able to identify their own condition, whether they are doing well with the sign of no cough, with chest tightness, and so on. And they have to know what kind of daily medication they should have to maintain their asthma. And if they got into an episode of asthma, they need to know whether the asthma is getting worse or not, and also what kind of quick relief medicine that the physician give them, and what is the like the flow, what can you do to minimize the symptoms. And if it is not really improved, then it goes into the red zones, which is the medical alert that need more attention and immediate response to go to the hospitals. It is really important for the patient to have asthma action plan to maintain their asthma while the patient at home. For the ambulatory care or outpatients department services, and while the patient are on their home, it's really important to control the symptoms that can be achieved by teaching the patient about the drug therapy and monitoring. It's also important to involve the patient caregiver. They should know where is the medication, what is it for, then teach them how to decrease the patient anxiety if an asthma attacks occurs. A good nutrition is important, and also physical exercise within the patient's limit of tolerance. Of course, it is beneficial. It is also beneficial to take relaxation therapy for patient. It will help them to more relax and decrease the respiratory rate. A healthy emotional outlook is also important in preventing asthma attacks. Asthma support groups are available online and around the country. Okay, the last part of nursing process is the nursing evaluation. Here is some things that you need to evaluate from the patients that to make sure the intervention is going well. Men, the expected outcomes for the patient with asthma is maintain patent airway with removal of excessive secretion, have normal breath sounds and respiratory rate, report decreased anxiety with increased control of breathing, correctly use medication, and they be able to express confidence in ability to manage asthma. Okay, that concludes our lectures for today. We've gone over the essential aspect of nursing management for asthma, and I hope this session has enhanced your understanding. But please take your some time to review the material, look into your textbooks, and don't hesitate to watch this video again if you need a refresher. Thank you for joining me today, and I look forward to seeing you in the next videos.